Hi, my name is John Fairfield. I was recruited as a physician in 1975 by the Hawkesbury General Hospital, and I practiced for 40 years. I was a general practitioner. I worked in the emergency room, on the wards. At one point, I became chief of staff for a period of 10 years. I also was medical director of the rehab unit for 8 years. Since 1975, I had a lot of experience as time went by, see the expansion of the hospital, new services being added and new equipment being added. Accommodation of patients in our hospital will be more beds, more surgical interventions, more new procedures being done at the hospital. The result of all this is a great reduction in patients having to travel to Ottawa for their treatment or to Montreal. Especially elderly had some difficulty going back and forth to Ottawa or Montreal with their ailments. And as time goes on, we're adding more services. One of the services that will be improved is the obstetrical service, where beds will be in a special unit where patients don't have to go through areas of the hospital that could be infected. Another important point is that the new ambulatory facility unit will be completely disconnected from the hospital should there be an epidemic in the hospital. In my role as chief of staff, I was responsible for recruitment of physicians. And what was clear was if we had the appropriate equipment for them to be able to perform at their best ability, improvements such as adding a CT scan 10 years ago made a huge difference in our facility to recruit physicians. And as you know, what we're doing now is changing this older scan to an upgrade of a more efficient scan, 4 times more performing. And of course, the new thing that we're adding is the MRI. The MRI will facilitate further recruitment of other physicians. I agreed to become president of the Access 2018 campaign, mostly because of my experience as a physician in hospital and recognizing that the roles of the foundation are numerous, but the most important role of the foundation is to recruit funds to help pay for equipment that is generally not paid by the Ministry of Health. The hospital has the responsibility of giving care to patients, but when it comes to buying equipment, it has to come from funds that have been saved and funds that come from the foundation. A very good example of how proper equipment makes a difference is the use of CT scan in the emergency room, and with new protocols for treatment of strokes. The treatment has to be done rapidly. Without CT scans, we would not be treating strokes appropriately in our area, and transferring patients to Ottawa or Montreal would be detrimental to the outcome of their stroke. If you're asking yourself why you should donate to the hospital, think in terms of HGH as your hospital. It's my hospital, it's your hospital, it's our hospital, and one of these days, either we or our family, our friends, those we love, our community will need treatment in Hawkesbury, and that should be the most important reason why you want to support our hospital. Do like me. It's your hospital. It's my hospital. It's our hospital. And one of these days we'll need it.